Hi, welcome to my channel. My name is Irene Soirassot-Joseph, a hospice regulatory consultant with many years of experience in helping healthcare organizations improve patient care while staying compliant with CMS and other accrediting bodies standards. As a former nurse surveyor and now a compliance strategist here at ILS Care, I am very passionate about making sure that care plans are not only effective, but also meaningful for patients and their family. So in today's video, we're going to focus on one of the most powerful tools we have in hospice, SMART goals. Now, whether you are a seasoned professional or just getting started, this is not just for the new nurses. This is for the well-seasoned nurses and some of you who's been very seasoned. I know how much of a headache writing goals can be. So in this video, I will give you clear, actionable insight to help you create patient-centered care plans that really makes a difference. So hello everyone. I am happy you're here with me today. Today we're going to tackle something that is really important and honestly one of the biggest hurdles in hospice care: writing SMART goals. Now I know we've all felt that moment of overwhelm when it comes to care planning, especially when CMS expects everything to be so specific and measurable. Now, one of the questions I'm going to ask you is that, did you know that goal writing is one of the top deficiencies CMS cites during audits? Yeah, it's a big deal. And as a former joint commission surveyor, I can second that. It is one of the top deficiencies across the line. But here's the thing. Writing SMART goals does not have to be complicated or intimidating. It's really all about taking the incredible care you're already providing and giving it more clarity and focus. So by the end of today, you'll have a better understanding of how to turn your assessment into goals that not only meet CMS standards, but more importantly, are meaningful for your client. So let's get in and let's get started. So SMART goals. So let's begin by looking at why SMART goals are so important in hospice. Now, SMART stands for specific, measurable, achievable, relevant, and time-bound. These elements are the foundation of a solid care plan. They help us avoid vague goals like, example, improve comfort or reduce pain, which can leave us without a clear direction. And I'm sure there is plenty more. Maintain comfort, patient will be pain-free. So I know there are hundreds of very vague care plans that a lot of us have used in the past that I'm going to show you how to turn those vague care goals into SMART goals. So when you're writing a SMART goal, it is important to follow CMS guidelines to ensure compliance while focusing on personalized care for each one of your patients. Now, CMS emphasized that the plan of care, the POC, should be patient-centered, measurable, and regularly reassessed. The POC is designed to address the holistic needs of the patient and the family when curative care is no longer an option. Now, this includes pain and symptom management, emotional support, and any other individualized care. Now, let's talk about the key element when writing goals, right? First of all, we said they need to be specific. Goals should clearly identify the target issue. So, for example, if a patient is experiencing pain, a specific goal might be to reduce their pain from 8 to 10 instead of writing reduce patient's pain. Now, when we're talking about measurable, right? So we had S for specific, now we're at M for measurable. CMS requires that progress toward the goals be tracked using measurable outcome. So in this case, we're using the pain scale, which is 0 to 10. Now, there's different pain assessment tools like the pain ad, but here we're going to use the 0 to 10 pain scale, which is the verbal pain scale. Now, the goal also needs to be achievable. The goal should be realistic within the time frame and resources available. So for pain, this could mean adjusting the patient's medication or therapy. The goal also needs to be relevant. So when we say relevant, it ensures that the goals are directly linked to the patient overall comfort and quality of life. Pain management, for instance, is critical for patient comfort. Now, CMS also emphasized that the goal needs to be time bound. So, which means that there should be a clear time frame for achievement, such as reducing the pain within 24 hours. In the next slide, I'm going to show you how to put that statement together so that you have a clear sentence when you're writing your goal. But when we're focusing on regulatory, CMS and all of the other accrediting bodies like the Joint Commission requires that hospice goals be individualized, regularly updated, and measurable to track progress. So one of the common deficiencies found in audit is the lack of specificity, right? They're not specified, and they're not measurable. So that's one of the top deficiencies that we find. The goals not being specific and not being measurable, which makes it difficult to assess whether the patient needs are being met effectively. So that is why when you're following these guidelines set by CMS when it comes to writing goals, you are not only providing priority of care, you are also providing the proper care to your patient and following guidelines. Now, what are the steps to writing the goals? So now I gave you all the requirement that CMS requires when you write the goals. So now we're going to go ahead and discuss how to actually write the goal. Now, in the beginning, when I was talking about goals, I specifically said that everything began with the comprehensive assessment. Your goal writing starts from the assessment that you've done on your patient. This is where you gather all the information, all the important details about the patient's physical, emotional, and their psychosocial needs. Think of it as your starting point. This is where we gather all the important details about the patient's physical, emotional, and psychosocial needs, right? So as you review the assessment, ask yourself, what is the patient experiencing right now? Is their pain well managed? Are they anxious or distressed? Do they have mobility issues? Do the answers to the question, having the answers to these questions will guide the care plan, right? Will guide you into writing a proper goal. It is not just about reading through the assessment. It's about really understanding what's going on with your patient. So you can create a goal that addresses their specific needs. Now, one of the ways that you can get a lot of your answers for these questions are having open-ended question. Now, if you're looking to see how their pains are being managed, you can ask questions like, what activities are most challenging to them due to their pain? What's their pain level, right? What pain level would allow them to feel more comfortable? You'll be surprised how some patient, the acceptable level of pain could be a 4, right? Some patients, the acceptable pain is a 5, but right now their pain is a 10. So your goal is to bring that pain level to their acceptable level of pain, which is a 5. Symptom controls, right? What symptoms bother you right now, bothers you the most, and how would you like it for it to be managed? Psychosocial support. The way you can ask that question is, who provides you with the most emotional support? How can we help facilitate those connections? Spiritual care, right? When you want to assess that, do you have any spiritual beliefs or practices you like us to support? Now, when you're asking those questions, make sure you're maintaining eye contact, you're nodding, you're you're encouraging you or encouraging nonverbal cues, right? And also when you're answering this question, make sure when you're gathering the answers to this question, make sure you give them back a brief summary of what you heard to ensure that you're understanding what they're saying to you. Avoid interrupting them. And I know as nurses, we do like to do that. And also avoid offering solution prematurely. You don't want to start saying, I'm going to go ahead and do this for you without finishing listening to their thought process, right? And of course, you validate their feelings and their concern. So that was step one. Step two, you identify the patient's specific needs. Now, once you reviewed the assessment, it's time to identify your patient's specific need. This is where you start prioritizing. Out of everything we've learned from the assessment, right, from step one, you want to find out what stands out as the most urgent, right? For example, if your patient is a pain 8 out of 10, that's clearly something that you actually want to assess right away. Or perhaps they're dealing with anxiety that's impacting their ability to rest. Now, by identifying these key areas, you can begin to structure goals that target what really matters, right? So with this approach, it allows you to focus on the patient's most pressing needs, providing care that's both effective and compassionate. Now with step three, let's turn those needs into SMART goals, right? Now that we've identified the needs, we're ready to create SMART goals. Now, let's say your patient pain level is an 8 out of 10. So instead of writing something broad like reduce pain, we're going to get specific and measurable. So how would we frame pain out of 8 out of 10? So let's be specific. Reduce pain from 8 out of 10 to 4 out of 10. Now when we talk, remember we said we needs to be measurable, right? So we'll assess pain every 4 hours using the 0 out of 10 pain scale. The next thing also needs to be achievable. We'll adjust the patient's medication based on their pain level. How is that relevant, right? Reducing the pain is critical for the patient comfort and quality of life. And then it also needs to be time bound. Our goal is to achieve this patient's pain level from 8 out of 10 within 24 hours. Now, when using this SMART framework, we make the goal clear and actionable. This also ensures that the entire care team is aligned and knows exactly what the target is. And if the patient pain doesn't improve, that's okay. We'll reassess and adjust the plan. It is all part of providing a dynamic patient-centered care. Now, a lot of organizations have uses EMR, and a lot of EMR already has preset goals already embedded into their system, but 100% of them, you have the ability of customizing them. So those goals that they have written is just for you to use and then, of course, customize and individualize a lot of them to the patient, right? So the way that the goal statement or state sentence would be written would be, the goal is to reduce the patient pain from 8 out of 10 to 4 out of 10 within 24 hours. And some of the interventions, right, the way that you would do that, it would be for the pain to be assessed every 4 hours, of course, by the caregiver, using the scale 0 out of 10. And of course, adjusting the patient's medication as needed to ensure their comfort and improve their quality of life. So you would use different interventions, but the goal statement itself would be written as, the goal is to reduce the patient pain from 8 out of 10 to 4 out of 10 within 24 hours. It is specific, it's measurable, it's achievable, it's relevant, and it's time bound. Now, the other thing, your goal need to be aligned to the patient's priorities. One other thing we can never forget in hospice is that our goal must align with the patient's priorities. Every patient has different values and needs. For one patient, the focus might be pain control. For another patient, It could be staying alert enough to enjoy visits with their loved ones. This is where having those open conversation with your patient and their family makes a difference. Ask them what matters to them most, what they want to achieve. So by aligning your goals with the patient personal priorities, you're ensuring that the care plan is not only clinically effective, but also deeply meaningful to the patient. Now, let's explore a real world example of how to write goals in hospice. So now let me introduce you to Mrs. Thompson. She is 76 years old. Um, Actually, Mrs. Jackson. I apologize for that. So let me introduce you to Mrs. Jackson. She is 68 years old, um, and who has advanced lung cancer. He's chosen to receive care at home, surrounded by the love and support of his family. Now, one of the key challenges with Mrs. Jackson is facing is managing his physical symptoms while also staying alert enough to enjoy precious time with his loved one. His assessment, Mrs. Jackson reported pain at a 6 out of 10, but his highest concern was his shortness of breath, which becomes really distressing, especially at night. Now, he told us that one of his top priorities is to stay alert and connected to his family during this time. So now in this scenario, our goal is to provide Mrs. Jackson with relief from her symptoms while honoring her personal wishes. Let's break down how we can create small goals that focus on his physical comfort and personal priorities. For Mrs. Jackson, two things are key here: managing his breathlessness and staying alert so he can be present with his family. Our goal is to support him in both these areas while keeping his comfort and personal wishes at the forefront of his care. So let's start by addressing one of Mrs. Jackson's key symptoms, right? The first one is his shortness of breath. This is causing significant distress, especially at night, and it's affecting his overall comfort. Now, how would I construct this goal, right? First of all, I will make sure that it's specific. Our goal is to reduce his shortness of breath episode from 4 a day to 2 a day. Because from his assessment, that's pretty much what he had told us, right? I would make sure that it's measurable. I will track the frequencies of these episode by providing him oxygen therapy to ease his breathing. Achievable, will adjust his oxygen flow and introduce some relaxation technique to help him breathe more comfortably. Make it relevant by managing his shortness of breath, will significantly reduce his discomfort and help him stay calm, especially during the night, um, when he's spending time with his family and or sleeping. To make it time bound, the goal will be to improve these symptoms within 48 hours. Now, as a nurse, when documenting, this would be how I would document this sentence. The goal would be: the goal is to reduce Mrs. Jackson's shortness of breath episode from 4 to 2 per day by adjusting oxygen flow and providing relaxation technique within 48 hours. Now, it's very specific because I want the episode to go from 4 to 2. Measurable, right? Uh, I will track the frequency of his episode by providing oxygen therapy to ease his breathing. That's how I would be measuring it. Making it achievable, I will be adjusting the oxygen flow, right? By adjusting the oxygen flow. Relevant, by managing his shortness of breath, he'll significantly reduce his discomfort. And of course, I will make it time bound, which is within 48 hours. We want those symptoms to be uh, pretty much reduced or improved. Now, with the second goal, it's supporting Mrs. Jackson's personal priorities of staying alert. So, how to make that specific? By making it specific, I will help Mrs. Jackson remain alert for at least 3 hours each day so that she can engage with her family. To make it measurable, I will monitor his alertness level during this interaction and adjust his medication to minimize any drowsiness. Achievable, we'll review his medication regimen to ensure it support his comfort without overly sedating him. Relevant, the goal is to directly align with what matters most to Mrs. Jackson, being able to enjoy quality time with his family. And of course, time bound. So the goal is to optimize his alertness within 72 hours. So what does this goal do? This goal allows us to balance his symptom management with his personal priorities. It's actually a great example of patient-centered care. And the way we would document this goal would be, goal is to enable Mrs. Jackson to stay alert for 3 hours daily by adjusting his medication regimen within 72 hours, which will allow him to engage meaningfully with his family. That's how you would document this goal. It's specific, it's measurable, it's achievable, it's relevant, and of course, we have a time when we want this goal to be achieved. Okay, so now let's discuss best practices for documentation and how that relates back to regulatory compliance. Documentation is essential for ensuring quality of care and meeting regulatory requirements. Now, in Mrs. Jackson's case, we focus on two very important areas: managing her physical discomfort and supporting her personal goals of staying alert with her family. By creating these goals, we can provide care that's not only effective, but also tailored to what matters to her most, right? So what's great about small goal is that it gives us a framework to follow. We know what we're working toward, how we're going to measure success, and how we can easily track whether or not we're achieving the desired outcome. This structured approach ensures that the care plan is always aligned, right? And it makes it easier to adjust the care plan as needed. And more importantly, it ensures that we are keeping the patient's well-being and priorities at the center of everything that we do. All right, so now let's discuss how we would document, right? The best practices of documenting goals, care plan. Now, clear documentation. One of the most important part of an effective hospice care is documentation. Documentation is what keeps everything on track. It is not just about checking off boxes. It's about making sure that the care plan is clear, everyone on the team knows what's happening, and the patient progress is accurately reflected. Now, you need to make sure your documentation is clear. It ensures that the SMART goals are measurable and trackable. Every goal should be linked to a specific intervention, and progress should be noted at every visit. So every single time you're seeing your patient, you need to be sure that you are tracking the progress every single visit, how they're doing, tracking their pain, all of their symptoms, their anxiety. Now, key documentation tips: be specific about what's being done. If you're adjusting the patient's medication, document exactly when and why. You also need to note the patient's response. Did their pain level decrease as you hoped? Did their anxiety improve? This information is vital not only for the patient's ongoing care, but also for ensuring that your organization is meeting CMS and regulatory standards. You also need to ensure that clarity. Keep notes clear so that the next nurse or team member can follow along. And of course, continuity. You need to maintain continuity. Documentation helps the care of the team stay informed, the care team stay informed and align. A well-documented plan means that the next nurse who step in knows exactly what's going on. It keeps everyone informed and, of course, ensures continuity of care, which is so important in hospice. Now, let's talk about the common compliance pitfalls that you would encounter and we need to avoid. The first one are vague goals. Avoid, and I will repeat this, and as a former surveyor, I can tell you every single patient, every single record that a lot of us would open up would have the exact same goal. And one of the favorite ones are improve comfort. Improve comfort. Remember, your goals need to be specific, right? Like reduce pain from 7 out of 10 to 4 out of 10. For example, if a patient reports difficulty breathing, instead of writing a goal to improve breathing, specify a measurable goal, just like I stated before for the pain. Specify it. Increase the patient oxygen level, saturation level to 90% or above within 24 hours. Now, to recap, this goal is specific, measurable, achievable, relevant, and time-bound. One of the other deficiencies you'll see a lot when it comes specifically to goals is lack of timely updates. You need to reassess your goals regularly and update the care plan as the patient condition changes. If your time bound is for the goal to be achieved within 24 hours, one would hope you would go back and visit this patient within 24 hours. When you go in, your goal was for the oxygen to be 90%. You go in, the goal is 95%. Let's pause on that. What should we see? We should see either the goal being discontinued, really, because we had it for 24 hours. Now that the goal is pretty much it's been achieved. Now her oxygen level is 95%, so we no longer need that goal. It is probably one of the biggest annoying and really, really biggest issue that we see is when we have those goals written for 24 hours and we're coming in 6 months later, a goal that was written in, September 2023, I'm here in September 2024 and I am still seeing the same goal. And the patient was seen several visits in and no one is looking and reassessing and updating those goals. You have got to remember that your plan of care is dynamic. That's what drives the care. It is the roadmap to the patient care. So, reassess your goals regularly, update the care plan as the patient condition changes, update, and you update the care plan regularly based on reassessment. Failing to update the care plan can lead to an inconsistency in care. For example, if the patient pain level has increased, their care plan should be updated to reflect these changes, and new intervention may need to be implemented if they're still in pain. The other thing that we see is inconsistent documentation. Make sure all team members document intervention clearly and consistently. Ensure all intervention are documented clearly. Clear and complete documentation is critical for demonstrating Clear and complete documentation is critical for demonstrating that you are providing appropriate care and meeting regulatory requirements. For example, if a patient is receiving pain medication, All dosage should be accurately recorded, including the time that the patient has administered the medication, is taking the medication, the type and amount of medication given, and the patient response to the medication. This is specifically for when you're going in and there's a crisis, and then you have to now administer some sort of medication from the comfort pack. So you have to make sure that you're documenting what was administered, the type, the amount of medication, and the patient's response. So by staying specific, consistent, and thorough, you can avoid a lot of those common pitfalls in ensuring compliance. For example, if a patient has a goal to improve their ability to eat, the care plan should outline specific intervention that will be used to achieve this goal, such as providing small, frequent meals, assisting the patient with feeding, or using adaptive utensil. Progress toward the goal should be documented regularly, and any changes to the care plan should be reflected in the documentation. Achieve compassionate and effective care with SMART goal setting is so critical. As a hospice nurse, your ability to turn an assessment into clear SMART goal is essential for providing centered care. It helps that your every need of your patient is being met in a measurable and then of course in a compassionate way. Thank you so much for joining me today. I hope this video is helping you, making you feel more confident in writing goals that are clear, actionable, and aligned with both the patient needs and of course CMS. Remember, SMART goals aren't just about checking boxes or compliance. They're about providing care that truly improves your patient quality of life. So of course, if you found this video helpful, don't forget to subscribe for more tips and insight on hospice care. And if you have any questions or comments, please leave them below. I'd love to hear from you. See you in the next video. And don't forget to follow and to like, and please share. I appreciate you all. Thank you.